In 2008, Mark Hepworth opened Abbey Dental in Ballasalla, and the practice is at the forefront of clinical advances, and every month Mark is going to be with us on the show to talk teeth, basically. So if you've got any questions, any queries, do get in touch and let us know, 166 177, or you can email studio@manxradio.com. We have got some questions which we'll come to in a moment, and today is all about finding out more about the team at Abbey, the sort of treatments that are available, and it's quite apt really that we're talking about this on A-level results day, because if anyone is interested in pursuing a career in dentistry, Mark, what is a likely path that they might take?
Well, normally quite high A-level grades is what you need to get in from a direct route. So down the A-level route, you're probably talking an A, 2 Bs from up to 3 As. And a lot of that's just competition with people wanting to get in at university. So then, assuming you get the A-level grades, you've got a 5-year course ahead of you. And then you can either go straight into practice or you can do a year's foundation training, which is now, I believe they call it foundation dentists. They don't call them training anymore because dentists didn't like to sort of be labelled as trainees, even now you've trained for 5 years. So that's one direct route in. The other way would be if you have a degree already. Science-based degrees are looked on more favourably than, say, arts and humanities degrees, but they'll consider everything. And with those sorts of degrees, you can sometimes miss out a year. So the first year might be a lot of biology, chemistry, physiology. So if you've done an anatomy degree or a physiology degree, they'll sort of excuse you that year and you go straight into the second year. So it's a shorter degree course, that one.
And is that the sort of path you took then?
No, with me, I didn't get the A-level grades first time round, but I had a place at a polytechnic. They used to have polytechnics in those days, to do pharmacology, which was all sort of drug research. And I did that for 3 years. Didn't really think about the dentistry after that because I thought, well, okay, I've got a degree, I'm at the university, that's where I'm going to go. I'm going to go down the science route. I worked for a year up in Newcastle. Then I did an MSc at Bristol. Enjoyed that. Enjoyed the research. Anything that gets your fingers wet. It's the kind of tinker. Dentists love to tinker around. We like to take things apart, hopefully get them back together. But that's what we like to do. So I did that and was offered a job stroke PhD. So I took that, did that for 3 years. And then I went to work at a drug company that was associated with Cambridge University. And as I got older, I kind of realised that I'd always wanted to be a dentist. It wasn't what I wanted to do, and the science didn't really appeal to me anymore. So I went back and applied to Liverpool University, and the rest is history.
And that's brilliant. It's really inspiring to hear something like that, particularly for people who might not have got the grades that they necessarily wanted today, because there is always another way to get to where you want to be.
If you want to do something sort of bad enough, then you look at the different ways of doing it. You can either go back to school, retake your A-levels, you can go down 1 degree route, you can get a job and get equivalency as you're working that way. And I can remember opening the envelope in August and not having the grades I needed to do dentistry, but having the grades I needed to do science. So it was kind of, okay, I'll do that. But it was the second choice, and yeah.
But as you say, all that is history, and now you do have Abbey Dental down there in Ballasalla. Just clear up, first of all, exactly where you are.
Certainly. If you go from Douglas towards the airport, as you go into Ballasalla and you turn left at the roundabout, we're just before the railway crossing.
Wonderful. And, dentists generally, they get a bit of a bad rap, don't you? We were joking about the fact that nobody usually wants to come and see you, but there's a lot of fear associated with dentists, usually from poor past experiences. I just wonder how you and the team down at Abbey Dental deal with that sort of thing.
Usually it's just finding out. There'll be one thing, sometimes multiple factors, but there might be one thing that someone's frightened of, a bad experience in the past. Sometimes it's just, if you think about it, if you're talking to someone, I mean, I'm talking to you now when we're 4 feet away, but a dentist is working 1.5 foot away from someone's mouth, so you completely invaded someone's personal space, not even just their mouth, but, the other thing is you're lying down, so you're in a vulnerable position from the very, very start. So there's a big trust issue. That's the important thing. If you can kind of build up a trust with a patient and a rapport, people usually feel a lot happier because they're more familiar with who you are, and the trust is there. And for me, it's a big privilege to treat somebody. And even if I'm just doing a checkup, so I've got a mirror in my hand, I might have a little probe. Probes are sharp, and so they immediately think, it's going to stick that into my tooth, it's going to hurt, it's going to scratch, it's going to be horrible noises. So there's all the negative side of things there. So we try and do things, we'll play music. Patients can come in with iPhones, iPods, whatever. They can have the music blaring as loud as they want, and as long as I don't have to shout at them because they can't hear me, but they don't hear the noise of the drill. We have lots of sort of scents, smells, because the last thing you want to do is have that dental smell. People walk in and just go, oh, the dentist. So again, even the garden outside, it sounds daft, but we've got lavender bushes. So as you walk past, there's this kind of smell of lavender to calm things down, and just scents inside. So silly things, not having the place too white, too clinical. The surgery is a clinic. It's got to be a clinical setting. But if you ask most people, if I asked you, do you tell me what the colour of your dentist's chair is?
Oh, I don't know. Greyish, maybe? Don't know.
You don't know.
No.
See, but you've sat in it.
Yeah.
But you haven't. But you've probably gone in and looked at the reception, and for that you'll kind of go, okay, is it warm? Is it welcoming? Is it a bit clinical? The clinic side of things is in the surgery. You want that to be clinical, clean, neat, tidy, professional. But the actual reception side of things, that's where you sort of want to sit down. You can watch the telly, you can get a cup of coffee. We get into trouble when patients come in and we've run out of Italian roast and it just so.
Those first world problems, isn't it?
It's terrible.
So we have got some questions in. Somebody's asking, does dental treatment always have to be painful?
No. And again, that's why I was coming back to you with the trust side of things. It depends what you're having done. I always say to patients, if we use numbing gel, we've got what they call a thing called a dental wand, which is a very slow anaesthetic. So it looks like a magic wand.
That
seriously.
Sounds really exciting.
It's quite cool. But it takes longer to actually numb someone up using that. But I wouldn't say it's painless, but it certainly reduces the pain that they've got. I've got quite a few patients that won't have anything else. They just say, no, I want the wand. And I'll go, okay, you're fine the last time? No. So you put the numbing cream on. That helps to take some of the sting away, but you'll always feel a bit of a scratch or a bit of pressure. So it's just letting people know that it's very, very difficult to be completely pain-free. So there's always a little bit of discomfort. But certainly when you're drilling, you don't want any sharp pain, but there'll be a pressure from the drill as it kind of rattles around the tooth, because your tooth's connected to the bone and it's connected straight to your head, so it feels like someone's shaking your head. But just let them know beforehand. We're going to use one type of drill, lots and lots of water. Going to use another type of drill. This is the rattly one. Just preparing them. So.
We've got another question asking, can you really have pure white teeth?
Not pure white. You can get pretty white. The Americans have a bleaching scale which is far whiter than ours. So a British scale will go up to this sort of 10 different shades, whereas the American one has another 6 shades beyond that. And really, really white teeth do look a little bit sort of fake. It's almost like kind of bleached bones in the sun. And they can be a little bit scary. You want a bright smile, but you can. My hygienist Paula, she's got pretty white teeth. Yeah.
Is it a case of as well sort of trying to almost match the skin tone in a way? Because I suppose if you have like a darker skin tone and you have very, very white teeth, you'd probably
look even whiter. Yeah. You can a little bit. I mean, some of the hardest things is trying to match, say, a crown to the teeth either side, because unfortunately you might find that the front tooth, the two front teeth, say, but one of them will be slightly darker than the lateral, which is the next tooth along. So you can't kind of graduate the colour, so it starts off dark and then halfway through goes white. So you're trying to blend that in, and that can be quite difficult. And the other problem can be the shade of a tooth in a room, even with daylight bulbs, will appear slightly darker than when you actually get outside in the daylight. So you can have something which looks absolutely great, and then the patient might come back to you and say, I was out at the pub, I was at a nightclub the other day, and it just seemed a bit darker than my other teeth. But now in the surgery, it looks fine. And so artificial light can throw things off as well.
I mean, is it okay to use whitening treatments? Because you read things about them not being very good for your teeth.
Yeah, I mean, there's quite strict rules as to the concentration and the amount of sort of bleach or peroxide is what they use, and any kind of peroxide is a bleaching agent. So the EU reduced the amount from about 32% down to 16%. It's actually lower than that for hydrogen peroxide. So there's quite specific amounts and rules of what you can use, even as dentists. If you're buying something from a dentist or from a store, then the levels are controlled and there'll be safe levels. If you're getting something, on the internet, that's where the grey area comes in. You can put acids into some of the whitening gels. What that will do is that will make the teeth even more porous, and so you'll get more of a whitening effect. But you don't want to drop a tooth into any kind of acid, because obviously that then is going to start damaging the mineral part, the hard part of the tooth. So that's where things can get dangerous. Teeth, when you whiten teeth using a proper gel, the teeth can still become a little bit porous, and so they can be more sensitive. So what you've got to watch is that you're using the right concentrations of the gel. You're controlling that sensitivity. You can do small amounts often, rather than, I'll whiten my teeth for 2 days straight and then wonder why the moment you have a glass of water, it feels like there's an electric shock going through your teeth. And yeah.
Do there's so much that we can talk about.
Loads.
We are, over the next few months, as I say, going to be talking about all sorts of different issues. But I just wanted to touch on the fact that the Isle of Man doesn't necessarily have the greatest reputation when it comes to tooth health. I know the rate of dental caries in children, particularly under 5, is quite bad. I mean, why is that? What are we doing wrong?
Some of it, it's just sort of, it's more education, as in, it's not so much the amount of sugar that people have, it's the frequency of the sugar. So very, very few people are born with, or when the teeth come through, have weak teeth. There are cases where there are certain conditions that mean you have weaker enamel, weaker dentine, weak tooth substances, but most of the time it's dietary, and it's kind of I don't want to label grandparents, but my parents, my mother once told me she'd pick the kids up, and there's a Tupperware box of sweets in the car, and they might only be allowed 1 or 2 sweets, but the kids are allowed to sort of dip in. So again, it's that frequency of sugar that causes a problem. As long as kids are sort of brushing twice a day, you're getting the fluoride protection there, but it's the way they brush and the frequency of sugar. My daughter was there, she's 8, and she was in town with my mother buying some sweets, you see. And I said, hang on, not allowed sweets, what's going on here? And Beth turned around and said, oh no, these aren't for us, these are for the car. So my mother obviously has a car that runs on sweets, but you see, this was for the box of sweets in the car.
Do you know what? I'm sure that resonates with many, many listeners this afternoon. Mark, so lovely to have you with us.